start the evaluation for infertility in that case.
Okay. Okay. Excuse me. Okay. So that well answered. So what is preterm labor?
So preterm labor is when a woman goes into labor and have a baby before 37 weeks of pregnancy.
Okay.
So I know everyone likes to think about pregnancy as being 9 months, but in actuality it's 10. But we let women believe 9 because just for sake of well-being.
Okay.
So 37 weeks roughly puts you at about 9.5 months. So anything before that period, you're at risk for preterm labor. And there are certain women that's at risk for it. So if you had a previous baby before 37 weeks, your risk of having preterm labor is about 20 times that of the average person.
Okay.
Okay. A lot of times there's things that we do if you've had a baby that was delivered before that 37-week mark that we do with the subsequent pregnancies to prevent that from happening again. Okay. There could be a variety of reasons as to why you may have preterm labor. But let's say if they find that the cervix, which is like the passageway to the womb, gets short or opens. Like sometimes we could put in a stitch or close it up like a purse for at least until 36 weeks, so that can help to prevent you from having a baby early. Another thing we do is we give a shot every week. For about 20 weeks. We call it it's a form of progesterone, a form of hormone, and that helps to quiet everything down so that you don't have the baby early. It's a big problem because with preterm labor, obviously you have premature babies. And with you having a premature baby, that baby have a lot of issues that could happen, like breathing issues, which is number one. Depending on how early the baby is born, especially if it's like around anywhere between 24 to 27 weeks, that baby is at risk for having neurological deficits, right? And so, it has a lot of burden financially on the healthcare system, and most importantly, has a significant burden on the parents and that family, and it puts a lot of strain. So it's very important that we try to prevent preterm labor as much as we can. And unfortunately, black women are at higher risk for preterm labor than any other group in this country, and even abroad.
Are there any significant reasons?
Well, so, they did, the funny thing is, like, if you took Africans in Africa, right, their risk of preterm labor is actually lower than black Americans here in this state. But if you bring those same Africans to America, they start to assume the same rates of premature labor as their black American counterparts. They've done studies to kind of see or examine why that is. One thing they found, it could potentially be just stress in general, just maternal stress, stressors with life, job, work, things like family. So they're assuming that may be it. Okay. Sometimes what another thing they look at is just socioeconomic status. So people who make less money may be higher risk for preterm labor. Okay. But sometimes among black people, even when they control for that in the studies, they still are at risk for preterm labor. Obviously, if you smoke, that puts you at risk, alcohol, things like that. Yeah, but black women in general do tend to have a higher risk of preterm labor.
Wow, it's very insightful. Can you also go into menopause a little bit? Because we know it's obviously, an issue, not an issue, but we live with it, with our moms, aunties, mother, whatever. So please go ahead.
So, menopause it's a natural part of the female reproductive cycle. Okay. So on average, the average woman would go into menopause around age 51. Maybe a little bit earlier or maybe a little bit later than that, which is fine. Okay. Now, if this happens before the age of 40, that's a whole different issue that needs to be addressed. But between the ages of 41 up until, like, let's say 56 is pretty normal. Okay. Some women go into menopause gracefully, where they may have some, like a little bit of hot flashes of the feeling of being warm, But other women, it's miserable, okay, because the hot flashes happens all the time, which then makes them very irritable and cranky. And then also they have issues with just vaginal dryness. And then with that happening, they just don't have the same desire sexually. Okay, so of course that has its own issues from a marital standpoint. Right. But yeah, those are pretty much the main things that you see with menopause. So the hot flashes, the vaginal dryness, the mood irritability. Okay, the thing is, there is a treatment for that.
Okay. I was going to ask you what can they do to feel better?
So the reason for menopause is that your ovaries, which help you to get pregnant, the hormones that it produces is no longer producing those two main hormones, which is the estrogen and which is the progesterone. But the estrogen is the main issue. Okay. So a lot of times, if you're having these really bad hot flashes or having all these symptoms of menopause, we can replace you with the estrogen, which we call hormone replacement therapy, or simply just hormone therapy. There's different doses. So we can always start with a low dose and then increase as your symptoms progress. Okay. But menopause in general lasts for about anywhere between up to 10 years. Okay. There's a subset of women, about 10 to 15% of women, that will have these issues past 10 years, and we can still address it, but normally it lasts for about, on average, 5 to 10 years. But the symptoms actually gets better as you get closer to that 5 to 10 year mark.
And do you use it as something like maybe a pill or workout?
So estrogen now comes in so many different forms. So you can take a pill daily. They even have a patch that you can put on. There's a ring you can use. There's creams. There's gels. I mean, there's so many different forms of estrogen that we give to women to treat whatever issues that they have. Estrogen is the best treatment actually for menopause. But for some women that have like high blood pressure or high cholesterol, that's not really well controlled, we can't give them estrogen because it makes those issues worse. And you don't want to put them at risk for a heart attack. Okay, so in those women, you don't have to suffer. There's just different things we can give you. Sometimes some blood pressure medicine can actually help with your hot flashes. So you don't have to suffer with this. You just have to talk to your doctor about it, and there is a treatment. Okay, so there's so many different things, both with estrogen or non-estrogen, that can help with these hot flashes. Some people, they want to do a natural remedy. So sometimes black cohosh, which is spelled obviously B-L-A-C-K, and cohosh is C-O-H-O-S-H. You can buy it at any health food store, Amazon, things like that. And they find that actually helps with like the hot flash symptoms. It may not be as effective as hormones, but it's something natural that you can use to help with it.
Brilliant. You see, listeners, we are still logged on to WGHC 98.3 FM, your voice, your music, your station, and this is the Progressive Mind Show with your host, Alinko. You know, one of the reasons why we do this is that many years ago, you know, our mothers, our aunties, you know, siblings would have this situation, would be going through menopausal situations or flashes, and they just deal with it. But times have changed, like you said. There's so many ways you can treat it. And so if you're listening, you can inform your mom, you can inform your auntie, or somebody, if they are here and they have access to medications and they are well informed, medically, or then that's fine. I mean, they're already taking care of this. But if they're not, then please advise them. Or you can ask them to tune in and listen, and then take advantage of ways of which they can, manage their situation.
Symptoms,
right. And also, you can also pass this information to our people back in Ghana and Africa. That you don't have to deal with the symptoms
and
just
suffer.
You don't have to suffer. There are ways of handling, managing it, and taking care of it. And you can buy them some of these medications and send them home.
Well, the thing is, like with the estrogen, that's a prescription.
Oh, that's a prescription. Okay.
That's a strictly by prescription, because of the risk of heart disease. You have to monitor them. Okay. So a lot of times, the doc will have you come in maybe every 3 months or even 6 months just to make sure everything's okay, and do a blood pressure check, because we know for certain it can drive your blood pressures up. But one thing, even though estrogen is a great treatment, problem is it's not well covered by insurance. Okay. Especially if you don't have like a commercial insurance like public, Blue Cross Blue Shield. So a lot of times, even if you have a doctor that's willing to give you the prescription, sometimes it just costs so much. I had one patient, it cost like $400 a month to be on this medication. So with that, of course, that can be a huge barrier for women to actually take it. But if you talk to us, we can find you something to help treat these symptoms.
Absolutely. Thank you so much. For our Facebook, should I say feeders or live followers? I'm not too sure with the term, but if you're watching us, if you listen to the program via Facebook Live, we had a little technical issue, and so we went off a little bit. We are back now, and if you're not able to access and watch live, please tune in. Go to your TuneIn app and then and get logged on, because the information we are sharing is very important. You can also call 563-999-3221. 563-999-3221. The number to ring in to ask your question or contribute again is 773-942-7167. 773-942-7167. If you have any recommendations for us,